relationships, and what are some healthy ways to change as we work towards independence? All right. A little bit about me as your presenter. I definitely want to give you guys some information on me. It's like, who is this lady? What is she talking about? Does she know what she's talking about? But I have been in mental health for about 15 years, 10 years practicing as a licensed clinical mental health counselor, an approved clinical supervisor, so assisting counselors in training towards their full licensure. And with that, I've worked in higher education, community-based nonprofit organizations, hospitals, residential psychiatric facilities, and private practice. Currently, I'm the owner and clinical supervisor for A Wise Decision. So what is codependency? Codependency, it's the act of being codependent, which when it is exhibited when one prioritizes the focus of others while avoiding their own needs. Individuals who are codependent exhibit behaviors of self-sacrifice, passiveness, and personal incapability. Now, these individuals attach their self-worth and happiness to others, all while ignoring their own emotional and or physical well-being. Some synonyms you may hear when people refer to individuals that they may believe are codependent. They are attached to each other. They are mutually dependent, hooked, addicted to each other. I actually think that these synonyms actually play into the misinformation that is sometimes being spread. So some of our common causes for codependency. Now we know that our expectations for relationships in adulthood are usually, well, are definitely rooted in our experiences that we have on in early life. So the experiences we share with our parents or parental figures help us shape our beliefs on how we should be treated by others. So it is these experiences that can lead to codependent behaviors. And right now I have on the screen, I have a few of the common causes for codependency in adulthood. The first one that we have is childhood neglect, right? So when caregivers fail to provide support and guidance, it can lead to children believing that their needs are not important. So what that looks like in adulthood is an adult who ignores their own needs and avoids asking for help which can lead to codependent friendships and relationships. On the flip side of that, we have the overprotective parent. Now, this parent, like I said, is the total opposite of the neglectful parent. This is more of our helicopter parent. This is the parent that's extremely controlling and shielding their children from any challenges. And this is preventing them from developing critical skills that will serve them in adulthood. Next, we have the permissive parenting style. And this parenting style, I say, is kind of a combination of the overprotective parent and the neglectful parent. Love and affection is usually given freely in these relationships. However, boundaries and accountability are not. So individuals growing up in this environment usually lack self-discipline. As an adult, these individuals, they usually do not respect others, they do not respect their boundaries, and they do not know how to foster boundaries for themselves. Now, we hear a lot about abuse, and we know that children who experience physical and or emotional abuse are victims that have their development severely damaged. And this leads to many maladaptive behaviors in adulthood, right? So in codependency as an adult, this is kind of a key behavior that's exhibited, children that are survivors of abuse. These individuals are usually looking for validation, external validation, and they're also looking to keep themselves attached to those family and friends. And then finally on our list, this is not the only thing, but finally on our list, there's the parent that struggles with substance abuse. So children that have to manage a parent struggling with substance abuse or substance misuse is often parentified at an early age. So they are thrusted into these caretaker roles. And what this looks like in adulthood is someone that just doesn't understand healthy relationships or what appropriate roles look like within those relationships.
Atia, I have a question.
Yes, ma'am.
Can you give us a little bit more I guess, definition of what parentified means?
Yeah, so parentified is when a child is thrusted into that role of a caregiver at an early age, right? So they have become the parents for their parent at 5, 6, 7, 8 years old. And so they're taking on these roles and these stressors of a parent in a child's body.
Okay, thank you.
You're welcome. So we do know that unhealed trauma from childhood can manifest in our adult relationships, right? And this leads to codependent behavior. Some of those behaviors may look like this list here. So first we have our need for external validation. Now these individuals, they are craving attention and reassurance. There is this fear of abandonment. And I honestly think that this is where that definition of clingy equating to codependency comes from. It's because these individuals have a fear of abandonment. So they may seem clingy, but not understanding that this is really unhealed childhood trauma. There's low self-esteem when there's a tendency to believe that they are unworthy or they do not deserve respect and love. We have our people pleasers. These individuals, due to their parents being emotionally unavailable to them, in adulthood, they struggle with those boundaries and that sense of true love and affection. So usually our people pleasers are the individuals that believe that they have to buy love or they have to earn your love and attention. Codependency also impacts our communication and our communication skills and our boundaries, right? So avoiding feelings to prevent upsetting others, lacking of confidence, a lack of sharing your feelings to prevent others from being upset with you, coming from unhealthy environments, they have this perceived inability that they cannot or they do not deserve that respect. So they won't enforce those boundaries or create those boundaries when they are feeling challenged. Now, on the other side of that, there are individuals that have challenges with trusting others. And this is excuse me, and this is due to not being able to rely on the adults in their lives growing up. So that feeling, that belief goes with them into adulthood. And so again, I was not able to trust these individuals. So why am I able to think that I'm going to trust others? I think I see a question or something in the chat. No? Okay. All right, and constant feelings of guilt. So there's that unhealed trauma from childhood that can leave others struggling with guilt, shame, and directly affecting their self-esteem. Codependency also impacts our ability to regulate our emotions sometimes, right? So those that have experienced volatile situations can link that these things can linger, causing unwanted responses to perceived threats. So this can look like outbursts, this can look like shutting down and even isolation when you're easily triggered and unable to manage those emotions. And then it also impacts our need for control. So we know that control issues are rooted in insecurity, fear, anxiety. Instability can make one feel powerless. So feeling powerless can lead to controlling behaviors. But also on the flip side of that, someone that is impacted by codependency may also allow others to control them, again, because they are dealing with that need for external validation, low self-esteem, and wanting to people please. Here are some additional impacts that codependency can have on one's life, right? So there's this loss of your authentic self. You do not know who you are outside of this friendship, outside of this relationship, outside of this family. There's this deep feeling of loneliness because although all these people are around you, you still have not dealt with that unhealed trauma. So there's this hole, this void, this sense of loneliness that one may still feel. Um, you define yourself based on the actions of others. So if someone's not talking to you, it's what did I do wrong? Why am I not receiving their attention? What can I do to make them talk to me again or make them like me again? And what that leads to is a list of serial toxic relationships because we are not dealing with that underlying issue, which is that unhealed trauma that's causing these behaviors as a defense mechanism. which then leads to burnout and psychological risks with your mental health. So I shared with you guys earlier that here are a couple of questions that one can ask themselves if they are thinking like, hey, am I codependent? Do I know someone that's codependent? These are just a few questions that you can ask yourself. By no means are they all the questions ever asked, but this is something that where you can do a self-inventory. One of the biggest things in overcoming codependence is this ability to be self-aware. And so these questions tap into how honest you are going to be with yourself. So we have questions like, do you feel responsible for the well-being of others? Do you judge yourself harshly when unable to meet the needs of others? Do you try to control events and how other people should behave through coercion, advice giving, manipulation, or domination? Do you get confused and or frustrated about how to handle your relationships? Do you believe that it is selfish to put your own needs before the needs of others? Do you avoid addressing your real feelings for fear of rejection? Or were you raised by a narcissist, an addict, or an abusive caregiver? So now we're all grown up and we are into the relationship, right? We have not healed that childhood trauma. And how does it manifest? Well, in the late 60s, Dr. Stephen Cartman created something called the drama triangle. He took this triangle to illustrate the way our dysfunctional relationship patterns fit into actual roles. So you see at each point of the triangle, we have the different roles. We'll start with the persecutor, right? So this person is usually someone who's controlling, they lack accountability, very critical, very rigid, have a superiority complex. Their voice may sound something like, it's all your fault, or you need to do this, or just very, very demanding are these individuals. Then we have the rescuer. So this person appears to be the empath. They have this savior complex, right? So they have this feeling of extreme guilt if they're not able to fix the problems of others. Now, with the rescuer, we do want to be careful because this can also be a manipulation tactic feeding into their own codependency needs, right? They use that tactic to help someone such as the victim and keep them dependent on them. The rescue voice may sound like, hey, let me help you. Hey, I got you. Don't worry, I'll take care of it. But all to feed their own self, their own need for feeling needed and wanted. Then there is the victim. This person always feels oppressed, helpless, hopeless, ashamed. They have difficulty making decisions. They may sound more like, woe is me, poor me, this always happens to me. Also, they don't always take accountability either. Now, the thing about our relationship triangle is that sometimes we can change roles within it. So it depends on who the relationship is with, what the dynamics of that relationship is. The rescuer can become the persecutor. The victim can become the persecutor, right? So if I am attempting to fix your problem as the rescuer and you don't do what I say or what I've shared or suggested to you, I can then become aggressive, bully you into doing what I want you to do, demanding that you do what I need you to do. Same thing for the victim, right? If you are not giving me the help that I am telling you that I need because whatever the reason may be, I can become aggressive, angry, and spiteful because you are not feeding that need of taking care of me. The great thing about this is once a person can identify what the role is that they play in this dysfunctional relationship, they can actively work towards breaking those negative cycles. Any questions? Well, here we go, guys. Here are some healthy changes towards your independence, right? So what does that look like? The first thing, did I hear someone?
We have someone that said, this makes a lot of sense. Thank you.
Oh, you're welcome. So healthy changes toward independence. The first thing that you want to do is define a healthy relationship. And when I say that, I mean for you, right? So understand that this encompasses your family relationships, your romantic relationships, your friendships. What is a healthy relationship for you, right? How do you determine your individualism? What are your personal values and your needs? What are your non-negotiables? And are you free to make those choices when necessary? Next, you want to create boundaries and rules. You want to understand the difference between boundaries and rules, right? So how do you show up for yourself, and how do you expect others to show up for you? Boundaries are for you, rules are for others. One thing that I think, if you don't take anything else from our talk today, is that boundaries should never get in the way of a healthy relationship. Sometimes there's this discrepancy there, but if these are your boundaries, they should never get in the way of a healthy relationship. Kind of share this with you guys to develop this sense of self-awareness. I think this is also very, very important. If you are looking towards creating a healthy lifestyle, healthy relationships, it is going to require you to sit in that uncomfortable feeling and process those feelings, those experiences that you buried so deep down, and now they are exhibiting, or they are showing themselves as being a part of codependent relationships, right? So through introspection, reflection, and honesty, you'll definitely get there. The great thing about this is that you don't have to do this alone. There are licensed professionals that can help you on this journey. Dealing with trauma is extremely serious, and you don't want to open up a can and not know how to put that lid back on when necessary. So do not try to do that alone. And then finally, we want to practice self-care. And this is so much more than getting our bi-weekly mani and pedi, or our new do fresh cut dinner with our friends. It's about paying true attention to your boundaries. This is a level of self-awareness where you have to dig deep into yourself, right? It requires you to deal within reality, with the understanding that you are learning to deal with life independently now, while learning healthy coping strategies, and also challenging those maladaptive behaviors that you've used as a defense mechanism for so long. Well, I feel like I spread through that, but these are the references that I used to create my presentation for you guys today. And that concludes our mini session on codependency.
So I have a question.
Yes.
Because I used, like, in the past when I was in relationships, it would be codependent, but now in the relationship that I am in, there's a level of dependency, right? In a relationship, especially if you move into relationships that turn into like marriage, there's a level of dependency. So how do you make sure that you don't slip into old patterns of codependency, or like when you can recognize those flags? Or I guess, what's the difference between a healthy dependent relationship and does that make sense?
It does. It makes perfect sense. And yes, in a marriage, there is this level of dependency. With parents and children to a certain age, there's this level of dependency, right? But you have to understand yourself. So if you are feeling that you do not have a voice, or you are feeling that you are making yourself smaller for that individual, these are signs that it may be a codependent relationship. Now, if your husband's asking you to make his doctor's appointments, like, maybe this is just our relationship. I'm better at making the appointments, he's better at cutting the grass, things like that. But when it starts to deal within your true self, and you feel like you are minimizing yourself for that relationship, I would say definitely seek a licensed professional to kind of explore that and process what that might be. Did that answer your question?
Yeah, so it just sounds like knowing what your strengths and weaknesses are, and knowing when yours are being ignored.
Absolutely.
Thank you.
Mhm.
And
So,
that you're
Dr.
manipulated.
Can you say that again?
And that you're not being manipulated into doing those things.
Okay, thank you.
I was looking at your list of, I think that I had the wrong idea of what codependency meant. And I think that I mean, obviously your presentation cleared it up. But in my mind, codependency was more like, I guess, well, let me just say what I'm trying to speak to. So I saw overprotective parent, right? Which I definitely know that I fall into that category. And I think that, so does that mean that being an overprotective parent may cause codependent children? Or am I codependent because I am the overprotective parent, or both?
It could be, it could be both, right? It could cause a child that is unable to adult, and it could be stemming from some things that you have not. Maybe there was a need that was not met, and I'm not saying you specifically, but I'm saying that it could a need that was not met in your child. So I'm going to make sure that my child gets this, and then overdoing it, which could lead to the codependent child.
Okay. I think because I mean, a couple of things that I saw myself in there, and I was like, "Sheesh, Lynn, you might have some."
Well, I mean, we're being honest, you know, a lot of us may have resonated with a lot of us. And so that's that level of self-awareness that we don't want to shy away from. Not saying that you're extremely codependent, but these are behaviors. It's not a diagnosis, right? So if I notice these behaviors, then I can work towards eliminating these behaviors so that I don't have codependent children, or I teach them how to get out of this codependency if they're adults now.
Yeah, I think so. I mean, I don't even know why I'm sharing so much, but um, in the drama triangle, I identified as the persecutor.
Okay.
I'm really controlling. I wouldn't call myself rigid, but others might say that because I'm so controlling, and I do expect. I mean, I don't know how you cannot have an expectation of behaviors from people that are close to you, right? I mean, it's just like, to me, that is kind of setting a boundary. Like, in order to be within my circle, I these are some things I won't accept, right? These are some things that I do. So I don't know how that becomes where the line is drawn to become controlling, right? I just know that I feel.
I think I understand what you're saying. So the line becomes controlling when you don't understand that others have a choice in that matter as well. So these are your boundaries, right? But they don't have to respect or follow them. And then now you have a choice to say, see, and now you have a choice to say that, okay, because you did not respect these boundaries, these are the consequences going forward. The controlling part comes in when you try to make someone do what you say. We can't make people do, we only have control over ourselves.
Okay.
And Dr. Atia, when you say, I'm trying to, I'm kind of in Lynn's boat here too, because I'm like, am I?
Well,
But
I mean, it's
when you
okay
say
because
make
I
them
identify
do
as
what
the
you
rescuer.
say, when you say make them do what you say, what would be some examples of how I would make someone do what I say, particularly someone that, is in my social circle or within my family? How do I make them, what are some examples of making them?
You can't make them, right? So you can't
But
make
I'll try.
so, exactly. And so how do you try that? Like when you try to make them, what are some of the things you do to try to make someone do what you want them to do?
Keep saying it over and over again. Demand, I guess.
That was one of this.
Throw out consequences, maybe deliver consequences. I mean, it depends on who it is and what I'm trying to get to make them to do.
Exactly.
But it's always going to be, in my mind, it's always, I'm not, like my mother used to say, I'm not trying to harm you. I'm not doing nothing against you. So, it just trust me and do what I say, and we'll go places.
Now, I'm not saying that your intention is wrong, right? Your intentions are very, very noble, but you have to realize, now we're not talking about our underage children, right? We're talking about adults. So these are adults. You cannot make them do what you want to do. You may see the end goal being productive for them, but that is not your decision. And so we stress ourselves out trying to demand others do what we want them to do, even though we know this will be beneficial for you. That's not your path, that's their path. Make sense?
Yeah, that's what they say. And I do have another question, and I can't remember exactly when you had the, I guess, list of things. Can you pull your screen back up real quick? Because it was a lot, and I was like,
Ooh.
ooh,
I
uh-oh.
probably should have gave a disclaimer, right? I'm a New Yorker, so I talk.
So we won't be
Yeah, I talk really
triggered
fast.
to reflect on our own
Yeah.
issues.
Okay,
Let's
hold on.
see.
All right, let's
Trying to
go.
remember, it's the one
Tell
right
me where to
before
stop.
the drama triangle.
Okay. There we go.
That one. Go back. I'm sorry. It was two before. Go back two, I think.
Not this one? This
This one
one?
right here. Oop. The one in between.
This one.
Yep. The
Okay.
self-assessment. That's where I've been stuck since we got to that screen.
Okay.
Okay. So my experience when reading this screen was that, like, on the left, I'm like, yeah, I feel responsible. Yeah, I judge myself harshly. And do I try to control? We just discussed that. But then when it got down to it stopped, like my role stopped at advice giving. When you got to manipulation and domination, I was like, nah, the other ones maybe, but not those two. And then we went over to the right, it was like, no. So I guess what do I do with that information within my self-assessment when I'm just like, all the positive ones are me, but
Mhm.
all the negative ones are not me.
So let me ask you a question though. You say all the positive ones are you. What
Because
makes
the
you
other ones seem positive to me.
okay? And so right, so you have determined that because I identify with these are positive traits. Someone
Exactly. Exactly. And I don't identify at all with manipulation or domination. I'm in my lifetime, I'm sure I've manipulated situations and people. But
there we go. There we
well,
go.
yeah, but it's not my go-to. It's not like I'm constantly thinking, how can I make this turn out the way I want it to? And dominate what?
Have you
In my
ever
mind.
taken control
In
of
my
a
mind. I
situation?
don't know if people that know me might be like thinking otherwise, but go ahead.
So I was going to ask, so with domination, have you ever tried to take control over someone else's situation to get it done for them?
Frequently.
That's domination.
That sounds like too negative. Couldn't that be supportive? Couldn't that be supportive though?
I mean, it could be supportive in another realm, but for codependency, domination.
Okay. through the lens, the framework of codependency,
It
it's
is
manipulative and
and
dominating.
dominating, yes, because
Okay.
ultimately I'm getting them to do what I want them to do.
What they need to do, Dr. Atia. I think that's the part that I get caught up on.
You think they need to do
Okay.
that.
And I'm like, don't we all?
Don't we all?
Okay. All right. So it sounds just like a lot of self-reflection on my end.
For all of us. If I'm being totally honest and vulnerable to you guys, I think I teeter between rescuer and persecutor sometimes, right? Like, let me fix this for you. And if you don't do what I told you to do, I can, like you said, Nikki, I can give some advice, coerce, support. So if we're all honest, we may see a little bit of ourselves in this list. And that's okay. It doesn't mean that you're codependent. It means we might have some tendencies that we are now aware of. And so when I revert back to that as my defense mechanism, because somebody's not listening to what I'm trying to give them in this support, we think back to that and say, okay, well, let me take a step back. So it's all about being better. When we know better, we do better.
True. Thank you.
You're welcome.
Well, I have a question about like the childhood experiences that lead to those behaviors in adults. Where does a child who lost a parent fit? Because that's really never talked about.
It's not talked about, but I do believe that it is part of this list. So like I said, this is not an all-encompassing list, but I absolutely think children that have experienced loss that early, especially of someone as a parent or caretaker, it can definitely play into those feelings of abandonment, those feelings of neglect, and it may even ooze over into the other parent becoming more overprotective. And so, yes, I do believe that loss early in childhood or even late in childhood plays a role in codependency.
So what, like, because after this slide, there was like the slide where it shows what kind of stuff would they would be likely to do.
Say that again.
Like, it was like, because you have a child who had to take care of their parent at an early age, they'll be more likely in their relationship to do this, that, and the third.
So this list is for all of the reasons that someone, or all of the common causes of codependency. So this list, it also includes someone that may have lost a parent, and other things that we didn't add to the list. Those were just some of the most common things that come up. Does that make sense?
Yes, thank you.
Okay, did anyone else have any questions, comments, any experiences they may want to share?
Yeah, I think as I do my assessment of myself, as of listening to this, I too am shocked to find out that I have definitely suffered in the past from toxic hero traits. So that was interesting and definitely worth staring in front of the mirror at. So I appreciate that part of the part of the presentation. Thank you, and I will be working on that.
Now, I don't want you all to go out and make a session with your therapist and be like, hey, I'm codependent. That is not what I'm saying, guys. I just want us to be aware of some of the behaviors and some of the traits that come up, you know what I mean? And so how we can be vigilant in making sure that we address those within ourselves.
That's a good point. And I like what you said about like the awareness part of it. So like, even if you're not involved in a codependent relationship right now, you know, going forward what one may look like. So yeah, that's I appreciate the be vigilant part.
Absolutely.
Dr. Atia, I appreciate the presentation and the way that you broke it down so that it was visual to us to be able to see and reflect and, you know, think about our own selves or just relationships with people that, you know, we are currently in. So I appreciate getting the information from you today. So thank you.
Well, thank you for inviting me. I was happy to share it. And thank you for the conversation. This was a good conversation, guys.
It was, I agree. All right. So I don't know if this is going once, going twice, if anything else, if anyone else had anything that they wanted to share, an experience or process, or any other questions for Dr. Atia. Okay. Well, Dr. Atia, we want to thank you for joining us today. We really appreciate the information, and we hope that we can utilize you as a resource moving forward, maybe for another presentation in the future.
Absolutely.
Okay. So if you would like to see any part of this, I did fall asleep a little bit on the record button, but I think we got it started right before you got into anything good. So if anyone would like to rewatch this, or get the information or the resources that Dr. Atia mentioned, you will be able to find it on our YouTube page, which you can access, if I'm not mistaken, through our website, lmfoutreach.org. And just for us, also for people who today is their first visit, thank you, welcome. We do this once a month, this Saturday session, which is topic driven, but then we also have weekly sessions on Wednesday, which is just like an open type of group discussion to talk about whatever participants have on their mind at the time. So thank you again for coming out, and we hope to see you again in the future. Have a great Saturday.
Thank you, guys. Bye.
Bye.
Thank you for being here.